Thank you for joining us today. We will be starting very shortly. We're going to give people a little bit more time to join, and we'll be back in just a moment. Good afternoon, everyone. My name is Ashley Rosick, and I am a physical therapist and the clinical director of our Midtown West location at Spear Physical and Occupational Therapy. I'd like to welcome back those of you who have attended one of our other webinars, as well as welcome those who are joining us for the first time. Thank you all for choosing to spend the next hour or so with us. We appreciate you taking time out today to learn with us. For those of you who do not know who we are, Spear is a private outpatient practice that has been around for over 20 years, with currently 20 locations located all over the New York City metro area. We have continued to successfully offer in-person care through the COVID-19 pandemic, and we are strategically going above and beyond the CDC guidelines to ensure the safety and well-being of everyone within our clinics. For detailed information on the safety measures we're taking, please visit our website at spearcenter.com. We have also launched Spear Live for those who are looking to stay in and receive care from the comfort of their home, as well as Spear on Call. This gives you the opportunity to receive physical or occupational therapy treatment through our telehealth platform from any device, or have a therapist come to your home for treatment. We are here for you in whichever way makes you feel the most comfortable. If you are looking for individualized care, please reach out to us at your convenience, and we'll get you set up for an appointment right away. We are here with you today because since the COVID-19 pandemic started, people have been working out on their own at home. And now that things are slowly getting back to normal, people are getting back to the sports they like and back to the gym. Our team of clinicians got together and agreed that given today's challenging circumstances, it would be a good idea to provide you all with some tips on how to both prevent and address any symptoms that you may be currently experiencing as a result of this new normal. We created today's talk specifically for you. We're coming to you live from our own homes and our impeccably clean clinics. We do not anticipate any technical issues today, but please be patient with us as we navigate working through this new technology. As part of our session, we will be demonstrating some exercises, and we really look forward to you following along and participating. I promise this will not be like your typical boring Zoom meetings. We're gonna have some fun today. Please note that if you are experiencing any pain while performing any of the exercises, please stop and reach out to us directly so that we can support you. Just some housekeeping. Throughout the webinar, we want to hear from you. If you have any questions, please feel free to let us know your thoughts in the Q&A feature. Let me take a moment to show you where that is. If everyone can hover at the bottom of your screen, you will see a Q&A option pop up. That is where you should put any questions you might have. We'll do our best to address any and as many of them as possible during the webinar. It is best to put the questions in the Q&A spot and not the chat. If you put the questions in the chat feature, we will likely not be able to get to them during the webinar. For those of you who are watching through YouTube Live, we are monitoring the comments there as well. Please feel free to type in questions you may have there. Lastly, there will be times where multiple panelists are on the screen at once. So while we are on a tour of the computer, for the best viewing experience, please select gallery view at the top right corner of your Zoom screen so that you'll be able to see all panelists at one time. So what we've all been waiting for, let's talk about our goals for the day and what we will be covering. We will discuss the anatomy and common injuries of the knee. We will then go over proper body mechanics for lower extremity exercises. And lastly, we will take some questions from all of you. Ultimately, we want to get you moving. We will be demonstrating exercises throughout the webinar that you can do to treat and diminish your pain. So please feel free to practice along with us as long as you don't have any discomfort. And without further ado, I'd like to introduce the rest of our panelists. We're going to welcome everyone onto the screen now. All right, so first we have Miss Kristen Markoe, who is a physical therapist and our assistant clinical director at our West 57th Street location.
Hey guys.
Next, we have the amazing Don Zerio, who is also at our Midtown West location.
Hi, everybody.
We then have Chris Cottrell, who is our physical therapist and the assistant clinical director at our Brooklyn Heights office. She will be helping answering all questions on the back end.
Hi, everyone. Thanks for joining.
All right, guys, Chris and I are going to say goodbye for now, and Kristen and Don will let you guys take it away.
Awesome. Thank you for the intro, Ashley. Good afternoon, everybody. My name is Don Zerio. This is my colleague, Kristen Markoe. We are both physical therapists at Spears 57th Street location. Super excited to be here today. We are here to present to you guys a webinar all about the knee. We're going to first give you a crash course on just anatomy of the knee. Then we're going to talk about some common injuries that you guys might be experiencing. And then we're going to get into proper body mechanics and cover exercises, which is going to be the fun part. So when we get into the exercises, we encourage you guys to kind of get up out of the chairs and do some things with us to make this interactive. And of course, if you have any questions, feel free to put it into the Q&A and we're going to be happy to answer those for you at the end. Okay. But before we get started, we're going to start with a couple of polls. We're just curious if we have our viewers out there have any knee pain that you guys are experiencing. So in a second, you guys should see the poll pop up. There it is. So first question, just yes or no. Do you guys have any knee pain? And then the second one, just put, where it is, front, back, outside, or inside.
So just talking about where exactly the knee pain. So if you're saying front, it would be in the front here, on the inside, on the outside, or then in the back.
Give you guys a few more seconds to answer that. So let's see what the answers are.
Wow.
76%. You guys got some knee pain. Okay. And front of the knee. Okay. Maybe we got some runners, Kristen?
Yes.
We'll
Shout out to all my runners out there.
Thank you guys for answering that. So with that said, we're going to get into a little bit about the anatomy. So Kristen's going to go ahead and cover this. And I have a little knee model right here. This is a right knee. Okay, if you're looking at it like this. So as she's explaining things on the screen, you can see the picture. I'm going to be pointing it out with my fingers. Okay.
All right. So first about the anatomy, we're going to go all the way down to the nitty gritty. So we're going to jump right into the bones. Okay. So if we're talking about the bones, the different bones that make up your knee, you have your femur. So that's your thigh bone right through here, right? You have your tibia, which is your shin bone all the way down here. You have your fibula, which is on the outside of your shin there.
So she's not on this model. Right?
Yep. And then you have your patella, which is just your kneecap, right? And then on top of those bones, you have your musculature. So you have all the different muscles that make up that knee joint. So you have your quadriceps, which is in the front of your thigh here. You have your hamstrings, which is all the way in the back, right? Back part of your thigh there. You have your popliteus, which is a smaller muscle, and it's located right behind the knee joint itself, okay? And that helps just to unlock and lock the knee. So when you're trying to bend and straighten that knee. And then the last muscle surrounding the knee is your calves. So all the way down here. Now, the way that your muscles attach to your bones is through tendons, okay? So each one of those muscles that I just named also has a tendon. So it goes muscle, tendon, and then attaches to the bone. So you have your quadriceps tendon, which can cause pain at the top of the knee. You have your hamstrings tendon, which is in the back, like those stringy things you might feel in the back of your knee.
These
right?
two guys.
You have your patellar tendon, which attaches from the bottom of your kneecap down to your shin. And then you have your calf tendons, your gastroc tendons, which are also in the back of your knee.
These two guys.
Okay. Now we're going inside the actual knee joint. Okay. So Don has a little bit better image than I can show you on myself, but you have your ligaments in your knee. So you have your ACL, which is in the front of the knee, the anterior ligament. You have your PCL, which is in the posterior part of the knee. You have your MCL, which is on the inside. And then you have your LCL on the outside, okay? So those are the major ligaments in the knee. And then on the inside of the joint, if you're looking right between your femur and your tibia, you have your meniscus. So your meniscus is cartilage. It helps with impact in the joint itself. So you have a medial meniscus on the inside of the knee and then a lateral meniscus on the outside of the knee. And then Don is basically just going to go over how your knee actually moves and how your joint anatomy works.
Yes. So what I guys want you to think about is how a door works, right? We have a door frame and some hinges, right? So if I turn this way and we open the door, close the door, that's how the door hinges. The knee basically functions the same exact way. There's a lot of different types of joints. The knee is called a hinge joint, right? So pretty straightforward. It bends and it straightens. It moves in just one plane, okay? But there are 3 planes of movement, right? We have this forward-backward plane that we call the sagittal plane. And then there's the side-to-side plane, which the knee isn't really supposed to move in. That's called the frontal plane. And then there's rotation, right? Rotation, so the transverse plane. If you could see, the knee is not really supposed to rotate. When that does happen, we do tear things, such as like the ACL or even the meniscus, okay? Can we spotlight ourselves, not the chart? There we go. That's much better. Thanks for the feedback. So the other 2 planes of rotation, okay, are influenced by our hip joint, okay, and our ankle joint. Those can move in all 3 planes, kind of like the shoulder that I'm demonstrating right now. All right. So I'm not really going to get into the hip and the ankle right now because this is about the knee. So we do want to talk a little bit about the injuries of these tissues that Kristen just kind of spoke to you about. So we have another poll that's about to pop up on the screen. It's actually about exercise, what type of exercises that you guys like to do. For those of you that have knee pain, we want to know if it's from any of these types of exercises. So in a second, oh, here it is. So we got running, free weights, right, which would be dumbbells, kettlebells, barbells, high intensity interval training. If there are other modes of exercises that are not on this list, then go ahead and put it into the Q&A because we would love to know what you guys like to do in your free time.
I myself am a runner.
Yes.
I like to run. Don would
I am the opposite. I love free weights, specifically barbells, kettlebells. Running always gives me plantar fasciitis.
Another exercise.
Okay,
Interesting.
good variety.
All right.
Otherwise, I would say we got some runners that come in close second, and then a few people that don't exercise. Well, we hope to change your mind after this hour.
Hopefully, we get you up and exercising after this. Okay?
All right. So with that said, we're going to quickly talk about some injuries, and then we're going to get into alignment and body mechanics. So, Kristen, what are some? Bring this down. Okay.
Yeah.
I'm going to change the screen. We're going to kind of talk a little bit about the knee. So we're going to kind of zoom in on Kristen's.
Actually, you can bring it up
a little bit right here.
there. Okay. Sorry, one sec. Okay. So we're just going to break down the different parts that I talked about before. So the anatomy of the knee. I'm going to break down different injuries that can happen to those parts of your knee and also how they can happen. So meniscus tears are pretty common. You'll hear patients have them. Sometimes they are surgical, where you will need surgery depending upon where the tear is in the joint, how big the tear is in the joint. Other times you can have a meniscus tear and not even know that you have it. You can be walking around playing sports and not know that you have that actual meniscus tear. But basically, if you want to show on the model, it's that inside of the knee, right in here. It's that cushion, that cartilage in between the knee joint. Yeah, right through there. And so what happens is usually it's a compression and then a rotation. So that motion causes a tearing on the inside. Okay. So a lot of the times you'll see if people say you're jumping and you're landing and you land wrong and it twists. If you're cutting or running, you can tear your meniscus that way. Deep flexion motions can also tear your meniscus. But that's just one of the different types of injuries that can happen inside the knee. Okay. And then from there, if we go into the ligamentous tears, right? So most common ligamentous tear is your ACL. You'll oftentimes hear about athletes doing this, playing different types of sports. Generally, this is a cutting motion when you're shifting weight from one foot to the other. And generally that happens when you are planted and you rotate the knee again, because that ACL on the inside there is being twisted too far and then it's being cut by your femur, right? ACLs are generally surgical. Most likely, if you're trying to get back to sports and be functional, be active, you are going to need surgery. The second most common would be MCL. So MCL, if this is your knee here, it's on the inside, right? So sometimes you even get an ACL, MCL, and medial meniscus tear. You want to put it down just a little bit so I can show the screen. So MCL, ACL, medial meniscus is generally that motion. So you take your ACL out, your MCL on the inside, and then your medial meniscus there, right? You can bring it back up. So also same type of thing, landing, cutting, and just not having proper body mechanics. PCL is in the back of the knee, LCL on the outside, less common, but that deep knee flexion or that lateral push off on the outside, generally that's more if you're getting hit by someone that you would tear your LCL. Under those would be a tendonitis. So different type of injury. The first two are more like the way you're landing and things. A tendonitis tends to be more of like an overuse injury. So remember we talked about your tendons are where your muscles attach to the bone, right? So it can be your quad tendon in the front. So quad tendon up here, patellar tendon down here. You can develop a hamstring tendonitis down here. Oftentimes those are from muscles either being weaker and overuse and tension at the actual tendon part insertion. It can be from being just really, really tight and the increased pressure that's being pulled on the bone where the tendon inserts. But generally those are overuse injuries that you will run into. Not noted before is your IT band. So a lot of the times, which is super common that we see, is iliotibial band syndrome, which is on the outside. So this is from your hip here, and then your IT band runs all the way and then comes down to the outside of your lateral shin, and that attaches all the way up at your hip. So what happens is a lot of the time, if you are weaker in your hips, this starts to become really tight and you keep getting that valgus force, which we'll talk about later, and you'll start to get a lot of tension and discomfort on the outside of your knee, maybe accompanied with some type of clicking, okay? Patellofemoral pain syndrome is anterior knee pain, which was one of the big ones that they said before in the poll. But it's basically if you feel like this diffuse pain around the knee joint itself, even behind your kneecap. What happens there is in the knee joint, you have a groove, right? So you have your kneecap, your patella, and that should ride in your femur. So your femur has a groove so that your patella can ride nice and smooth and that there's no friction going on. However, if you have muscle weakness, so say the inside of your leg stronger than the outside, if you have muscle tightness where your IT band could be pulling, or your quads are like not as strong from the inside on the outside, what can happen is then the muscle pull on your patella is incorrect. So you can start to get shifting of how the patella rides in that groove, and you start to feel this discomfort behind the kneecap. This is super common. We see this a lot with patients, and that's just figuring out how to perfect the imbalances in the muscles, whether it be something's too tight or something's too weak or vice versa. The next injury we have up there is osteoarthritis, which is also a very common one that we see, can lead to joint replacements. So that's why we're here, right? Our job is to try and prevent that from happening or prolonging it as much as possible. Osteoarthritis is just basically the breaking down of the cartilage in your knee. So having decreased space in that knee joint, right, well, yeah, we're done showing there. So things we can do to help with that, strengthen around the joint so that there's not as much pressure in the actual joint itself and the forces that are going through your leg are going through the muscles, trying to keep as much range of motion as possible to try and keep everything moving. But that's a very common one that we will see in the clinic. And then lastly is bursitis. So we didn't talk about the bursa before, but basically what they are, they're like little fluid-filled sacs, and they're in between where your tendons attach to the bone. So those bursa are there because they're supposed to help lubricate when your tendon is rubbing over the bone. So if they weren't there, it would be a lot of friction, right? The bursa are there to help with the smooth gliding of your tendon over your bone. And if those tendons are really tight, say you have a tendonitis and it's pulling and there's a lot of rubbing there, you'll get an increased inflammation in the bursa itself. And then you'll start to have that inflammation, that redness all around the bursa, and that will start to become uncomfortable and painful. So just different injuries to note that can happen around the knee. And then from there, we're going to take it into another poll question. So this is our last question, our last poll for today. And then we're going to have some fun, go over exercises and body mechanics. But the last poll.
True or false, squats are bad for your knee? We'll see.
This is a common question we get all the time when patients come in. Oh, this one told me, oh, I shouldn't squat. I'm not supposed to squat. So we just wanted to see what you guys were thinking at home, your thoughts on squats and if they are good or bad for your knees.
A couple more seconds. Let's see what we got. 82% said false. You guys are right. Squats are supposed to be great for your knees. Okay, actually one of the best exercises to really strengthen the knee and the knee joint and the muscles around. However, squats can be bad for your knee if you're doing them wrong, right? And there are several ways to do them wrong, okay? So we're here to show you all the wrong ways and how to correct that, and even to self-cue yourself if you're doing squats in the mirror at home, okay? So that's going to lead us into our next little topic here, proper alignment through the lower extremity, meaning the hip, the knee, and the ankle joints, okay? So Kristen's going to cover that, and then I'm going to get into body mechanics and specifically with some exercises that we'll cover next.
Yeah, so like Don said, honestly, the majority of what we do, yes, we have to assess patients, but a lot of the times we're just teaching patients how to do things correctly at home and teaching you how to align yourself when you're doing these exercises. So this is a super important part. I would really take note about these ones because when you are exercising at home, as a lot of us are doing now, you just want to make sure that you're doing things right and you're not going to end up hurting yourself. So you want to just check the...
Yeah, I'm going to be the cameraman.
All right. So this is my little spiel that I give patients when I'm talking about the lower extremity. Okay. So the first thing you want to think about is when you're looking down, right? You want your hips, your knees, and your feet, your ankles all the way down to be in one straight line. Okay. So when you're looking down, when you're doing any type of exercise, it should always be hips, knees, and ankles in line. There's different things that can happen that can cause that to be offset and for you to have your knees turned in, your legs turned out, your foot turned in. So that's what we're going to go over now. But basically when you're looking at your lower extremity, your knees are only flexion and extension, right? And most of the time they get caught in between your ankles, which can rotate, and your hips, which can rotate, okay? So what we're going to focus on is just making sure that everything's in line by activating the right muscles. So major muscle in your lower extremity that is important for stabilizing throughout are your glute muscles, okay? So your glute muscles attach from your pelvis here, and they come all the way out here, and their job is to keep everything turned out. So if you're looking at me from the front, you want to make sure that if your knees are falling in, you're not activating your glutes. So you want to try and squeeze your butt cheeks, turn out, and then you should have that straight line going all the way down, okay? So we want to avoid that internal rotation, that valgus moment at the knee, and we want to use those glute muscles to turn out and have that straight line, okay? Another thing that we look for when we're assessing is Trendelenburg. So that's when your hips are across. So you want to make sure that both hip lines are across when you're standing. A lot of the time what we'll see is if you have weakness in your glutes, you're going to get this hip drop, right? So you want to try and keep everything nice and stable as you're standing on one leg. So those two things, they come from your hips. Then you want to look at the knees, right? So a lot of the times you'll see people who say like, oh, I have knock knees, where your knees are turned in, right? But that's not really coming from the knees. That could be coming from your hips where you want to turn out, or from your feet if your arches are collapsing, okay? So as we're looking down and we're doing all these exercises, you really want to make sure that you're activating the right muscles, that when you're looking down, you see everything, hips, knees, toes, all in line. You want to make sure that your arches are nice and high, right? So you're not having that arch collapse, because if you look down, the moment that I allow my arch to collapse in my foot, it starts to shift where my knee is. If my arch is too high and I turn out, then my knee is going to be turned out to the
Maybe
side.
take the shoe off just so the viewers can see kind of what we mean by the arch. I
Can
think
you
most of you guys
see?
know what the arch is, but
So if my arch is collapsed, right, there's no space in between the floor and my foot. So you want to have some space there, okay? So from the front, if my arch is collapsed, my knee would fall in, versus if my arches are too high, then it's going to turn out, and my arches are too high, then it's going to turn out there, okay? And lastly, when you're doing anything, lunges, squats, anything like that, that we're going to go over, you always want to make sure that your knees are in line with your toes, okay? So when you're doing exercises, if you're coming down, you just want to make sure that everything is in line, that you don't have your legs falling in like this, your legs aren't falling in like that, that everything is just in one straight line. So now that was me going over just basic body mechanics, and Don's going to talk about more actual exercises that you're doing at home and how to use the body mechanics that I just talked about and incorporate it into actual exercises.
awesome. Thank you, Kristen.
Yeah.
And some of those things that you see on that slide, those words, we're going to bring those up again, just so you guys know, because those are terms that you might hear often in the PT world. So now we're getting into body mechanics, okay, the good stuff, the exercises that we're going to be showing you. So we're going to go top to bottom. So the first one, as we were just basically covering with our squats, okay, so we're going to spend a good amount of time on the first two, and then we're going to get into lunges. So Kristen, don't sit down for too long, because you're going to be my patient, okay? So as we talk about the squats, we're going to just keep this interactive. So Kristen's my patient here. All right, we're going to have her do a couple different variations of the squat that we typically see our patients doing, and how to kind of cue them into the right position and right alignment. So Kristen, let's see how good of a PT I am. All right, we're going to go do a couple of different variations here. So let's see the first one. We're going to do 3 repetitions of each type of squat. So let's see.
Okay, so first one, let's do.
Okay, good. So think about what she just spoke about in the last slide, okay, about that valgus, okay? So the valgus is that knee kind of turning inward, right? If I was to draw a line from the inside of her knee, it ends up on the inside of her foot, right? So let's do it the right way now, Kristen. Okay, let's get rid of that valgus. All right. There, see how her knees, you didn't see the feet, but see how the knees are now not bowing inside of the foot. Okay, so that's good alignment with the squat. All right, now let's go ahead and turn to the side. All right, and here's squat variation number 2 that we see a lot in the clinic. Good. Okay, there's rep number 1, 2, and 3. Good. So if you're looking at the knees and the ankles, you might not have seen much, but if you were looking at her back, you might have seen, do it one more time. There's a lot of bend here, okay, which means that there's too much bend at the lower back, okay? So for those of you who use free weights and you're doing squats, you can stand back up, all right? You're gonna be putting a lot of stress on your lumbar spine, okay? And that's probably gonna be a whole other webinar for you, okay? So when we're doing squats, I'm going to go ahead and trade places with you here, Kristen. Couple of things we want to think about. All right, so I'm going to use this pole, right? If you guys have a broomstick or a Swiffer golf club, this is a great tool to make sure that you're doing a squat correctly. And I'm going to show you how to use it. All right, so I'm going to give you the side view here. All right, and I want you guys to draw an imaginary line from my shoulder, okay, all the way down to my knees. I might need you to be the camera lady for me, Kristen. So when I get down into a squat, all right, my shoulders should be pretty much in line with my ankle, right? This pulls straight up and down. I'm nice and balanced. My knees are over my toes. My butt is sitting back, and my back is also nice and straight, okay? So if I put this behind my back, my head, this point right between my shoulder blades and right at my sacrum, okay, right at my butt, are all in contact with this pole. And throughout the squat, that all maintains contact, okay? If I start to bend forward like Kristen showed us, I'm gonna lose contact with that very bottom spot on that pole here, okay? So if you guys are doing this at home, doing this in front of the mirror, this is a great way or a great warm up to do with this pole before you start bringing weights into it, okay? Another thing, Kristen, just curious. If I were to squat with my feet pointing straight forward, how is that? Is that okay?
Yeah.
Right? Again, as long as my knees are not bowing in, that's totally fine. What if I were to turn my feet out a little bit? Is that okay?
So as long as you're coming down and your knees are still directly over your toes, this form is okay at your foot. Totally fine. A lot of the times people will say, oh, you shouldn't turn out, turn in. That is actually okay. As long as when you're turned out, your knee is not falling in like that and your knee's tracking over your toes, that's okay.
Okay. So also the width doesn't really matter, okay? There's no one magical stance for the squat. So you might have heard this, oh, got to be shoulder, hip width apart, feet pointing perfectly forward and squat, okay? Everybody's body is made up a little bit differently. Everybody's hip sockets, okay, might be in a little bit of a different orientation. The torsion of our bones and our femur bone right here, our thigh, might be a little bit different. So for me personally, when I do a squat, I got to be a little bit toe out, okay? And that's perfectly fine. That's how I'm comfortable. Some of you guys may be a little bit more comfortable with a wider stance or a little bit more narrow stance. That's perfectly fine, okay? It's not a one size fits all, but just keep in mind of those alignment tricks that we're talking about here. So this is really bad, okay? A lot of stress on the inside of the knee. So just make sure that you're not doing that. We see it a lot in this transitional spot, right? You might come down with this good alignment and then kind of do this little stanky leg wobble here as you stand back up, okay? So that's a squat in a nutshell for you, all right? Our next exercise on the list is called the deadlift. Not as common, you don't see it as much with the squat, but if you guys watch the Summer Olympics, you see these big burly people doing 500-pound deadlifts. It's actually a great exercise, not too much different from the squat, some minor differences, okay? But we're gonna play the same game here and then we're gonna talk about the right way to do it. So, Kristen, let's show us a couple of different variations of this deadlift here. Good, okay. And back up, let's do two more. Good, okay. So pay attention one more time. Again, a lot of this big old curve on her back, a lot of stress on the back, good. Now, if we're doing it the right way, she's gonna keep her back straight. Kristen, just slightly unlock your knees, okay? And then she's gonna keep her knees just there, okay? She's not gonna bend them more from there. She's not gonna straighten them from there either, okay? All you're gonna do, Kristen, is now just kind of shift your hips back, keeping your back straight, and she's gonna go down until she feels a stretch in the back of her legs, her hamstrings, okay? Do you feel it right there?
Yeah.
Notice how the bar doesn't go all the way down to the floor, okay? It does not matter how far the bar goes down to the floor. She feels a nice stretch, and now all you're gonna do is just push your hips forward, and that stands you back up, all right? So we can use this same little tool here that we did with the squat, right? These 3 points of contact. I'm gonna lock my knees, unlock them, they're gonna stay there, and then I'm shifting my hips back. I feel a nice stretch in my hamstrings, so they're loaded, and then I just push my hips back forward using my hamstrings and my glutes. And that's basically a deadlift, okay?
Which is great for your posterior chain.
Posterior chain. So posterior chain basically meaning all the muscles in the back of the body, okay? You may feel a little bit of lower back in this as well. Don't forget, you do have muscles in the lower back. So if they are weak, you may get some fatigue and tiredness in these muscles, and that's okay, all right? Those muscles just need to be strengthened like anything else, all right? So let's move on to lunges, all right? There are a lot of different variations of lunges, so I'm gonna cover a couple of them, and then Chris is gonna cover a couple of them. So the first one, all right, is just your standard forward lunge. I'm just gonna get this step out of the way. So forward lunge, okay, as you guys, I'm sure a lot of you know, it's just a step forward and a step back, okay? From the side, a step forward. You wanna take a big enough of a step forward where this, right, I'm here, and then I'm just kind of sinking down, okay? I end up in about a 90-degree angle at my front and about a 90-degree angle with my knee in the back, okay? And a lot of my load, I feel a lot of the muscles in the front leg working. There shouldn't be much going on in this back leg, okay? So here, all right? A back lunge, same thing, except I start here, I take a big step back, I sink down, stand back up. Back, come down, come right back up, okay? Same rules apply, okay, with the alignment, okay? It's actually a little bit harder to keep this alignment because you now are having most of your body weight on one leg rather than two, okay? So this valgus, you got to make sure you don't have that going into the lunge, okay? Any of these variations. So that's very important. I would make sure you master the squat first before you start putting lunges into your routine, all right? So Kristen, I have a question for you. If I have anterior knee pain, front knee pain, which we know some of you guys have, what lunge, front or back lunge, which would you choose for me?
So if you're having that anterior knee pain, which I know the majority of everyone had spoken about before, if you're having anterior knee pain, you want to do a posterior lunge. And the reason why is because if you watch, so if you go into an anterior lunge, so if you're going into a front lunge, right, you see how much force is going through the front of your knee. You're putting a lot of pressure. You're bringing your knee forward over your toes, right? So there's a lot of pressure going through the front. However, if you stand forward and then you sit back into a posterior lunge, most of your force and most of your weight is going in the posterior part of your chain, and there's not as much pressure because your knee's not as forward over your toes. It's mostly coming through your hamstrings and your glutes.
Okay. Pay attention, guys, to my shin as well. With a forward lunge, my shin will be angled a little bit more forward because, as Kristen said, that's where my momentum is going. So that's going to put a little bit more pressure on the kneecap and a little bit more stress on the quad, okay? Which for those of you who don't have knee pain, that's fine. You're just going to feel more tired in your quad. But on a back lunge, okay, because my weight and mass is going back, I can keep this shin a little bit more vertical, okay? And that's what makes you feel like you have more load on the backside, right? And a little bit less stress on the front of the knee, okay? So just something to keep in mind. So the last one I'm going to cover, okay, and then I'm going to take a breath of fresh air while Kristen talks. You haven't heard enough from me. I'll just use this because you guys pick a stool or the bottom stair if you have a stairwell at home. Coffee table works fine too. This is called the Bulgarian split squat. Some guy in Bulgaria, I think, made this up. It's just a guess. But basically, it's more of a static lunge, so there's no stepping forward, stepping back, okay? All you're going to do is just take a couple of steps forward, okay, away from your tool here. You're going to plant one foot, okay? It could be, flat, or you could be on your toes. It doesn't really matter. Just make sure you're balanced. And then I want you to feel like you're sitting back, okay, into that step. So I'm sitting back, pushing my hip back, bending my knee, and then just standing back up, okay? If I have weights or dumbbells, I could be here, okay? But again, the same rule applies. I'm keeping that good alignment, okay, with my knee the whole time.
Just bring it back this way for a second.
This way?
Yeah. So something also to note with the Bulgarian split squats that's really common when I'm showing patients is if you get into the Bulgarian split squat position, a lot of people will say they're having pain in actually this knee, like the back knee. If you're having discomfort in the back knee or the back foot at all, that means you're putting too much weight in that back leg. This should basically be like a single leg lunge, single leg squat. So all of your weight should be on this front leg here. That leg is just for balance. So if I ask you to do a Bulgarian split squat, you should be able to lift that leg up because it's just there to help you with balancing so you're not falling over. So if you're having pain in the posterior leg that's up on the ledge, then that means either you might not be ready for this, it might be too hard, or just try and shift your weight more towards the leg that's actually forward.
And that is it for me talking. We're going to give it to Kristen. She's going to show you the rest of everything that you see on the screen.
All right, cool. So now we get into my favorite exercises for all my runners, all my knee pain patients. Just something to note. So a lot of the times we do exercises that are forward and back, right? So running, forward and back, lunges, squats, everything's in this plane of motion. But a lot of the times the reason why we have that valgus at our knees and the reason why we have that Trendelenburg at our hip is because we don't have that glute stability laterally, okay? So yes, you wanna start off with your 2-leg exercises, your squats and your deadlifts. Yes, you wanna go into your front and posterior lunges, but you also wanna make sure you're getting all planes of motion. So that rotational stability, that lateral stability. So this is where I come in with all my fun lunges that I do with all my patients that everyone laughs at me for. But first we're gonna start off with our lateral lunges, right? So you can stand feet hip width apart. This is gonna target your adductors, your lateral muscles, your glutes. And all you do is you're gonna step out. You keep everything in line just the way that we had for everything else. Hip, knee, toes in line. You step out and then you push and then you come together, okay? So big step out, knee in line with your hips and your toes, and then coming together. And then from the side, it would look the same way, out to the side, and then come together. Okay, so that's gonna work a little bit more of your lateral and your inner thigh, just to help with that lateral stability when you're running, cutting, things like that. My other favorite exercise is curtsy lunge. So this is taking it back to when we used to curtsy, say hello. But this, you're gonna have your hands on your hips, so you make sure you're not dropping. You're going to step back at a 45-degree angle. You're gonna come back, all your weight is here, this back leg is just for balance, and you're gonna step down, all of your weight's here. Now this is a big one for like my medial meniscus, my ACL patients, because a lot of the times what happens is patients will do that valgus force, right? So this is super important that you need to work on stabilizing at your glutes and pushing out and having that knee right in line with your hips and your toes, okay? And then coming up. Same thing the other way, coming across, you're sitting down into it. Your weight should not be in the back leg. It should all be in this front leg, hips down, pushing up. Good. And then lastly, we're gonna go over just the step up and step down because a lot of times people will have pain with that. So you're going to step, put your foot through here. Same thing with everything we've been talking about. Hips in lines with the knees and the toes, coming up and then pushing down, making sure that there's no wiggling in there. A lot of times you'll see patients go like that, right? Same thing with the step down, just controlling that, pushing through your heel, tapping down, and then coming back up. And so like a lot of the times what we'll do with patients is we'll start off always with a double leg exercise. So you have your squats, your deadlifts, progressing to single leg, so front and back lunges, lateral lunges, but then you can also progress to multi-step. So if you're going from, you can go into a curtsy lunge and then come into a forward lunge, just different ways to make it a little bit harder for yourself at home. All right.
All right, so that is all the content we have for you guys today. I know we moved a little bit quick sometimes, so thank you guys for your feedback and telling us to slow down. But we want to use the rest of this time to answer any questions that you guys have. Thank you all for being here. And of course, in a minute, you'll see a slide with our information. We encourage you to ask us and email us with any questions that you might have.
All right. I was sitting in the dark there for a second. Thank you, Kristen and Dawn, for that awesome presentation. We are going to go over some of the questions that were sent in. Just a heads up, we have a lot of questions that were sent in, so that if we don't get to your question, please shoot us an email directly and we will try our best to get to you. One of the first questions is there anything you should not do if you have bone on bone?
Bone on bone, so knee osteoarthritis, right? So as PTs, our job is to encourage movement, right? We don't want you to fear movement. So, we want you to move as much as you can, as often as you can to your tolerance, right? So I'm not going to tell you not to do squats or lunges. What you might need to do is just modify some things a little bit. So, if you're used to squatting your whole life, butt to ground, and there's this range where, oh, my knees start to hurt more, just modify the depth a little bit, or play around with your stance to see, maybe there's a position where you might find that you have a little bit less stress, okay, going through the knees, all right? So it's perfectly fine to do squats and lunges, but you just have to do it to your tolerance, all right? And if you have a hard time figuring out and you feel like you've tried everything, then we encourage you to reach out to us and then we can help you.
Yeah, use pain as your guide, basically, and try and stay as mobile as possible.
Mm-hmm.
Great. Can a small meniscus tear heal over time without surgery?
So depending upon where the actual tear is depends on if the meniscus can heal on its own. The outer 1/3 still has blood flow, so that area of your knee can heal itself without surgery. But regardless of with or without surgery. Like a lot of times people have meniscus tears where it might not be on that outer 1/3, but you may not have that much pain, or you may be completely functional and we can get you to a functional level without having surgery. So that, I mean, coming in and just being assessed to see where you're at and where we can get you to avoid surgery is super common. I've had a ton of patients that meniscus tears and no surgery necessary whatsoever.
Yeah.
Great. Awesome. Does running affect arthritis in the knee?
I mean, not really. It doesn't progress it. Okay. I don't know if that specifically answers your question. Like, running doesn't make arthritis worse. Okay. Running is something you may have pain with, but there are plenty of people and plenty of professional runners, right, that have arthritis. And they can still run and have minimal pain. There's actually been research on runners, and it has actually shown that people who have arthritis and people who are runners and people who are more sedentary, which means you don't really exercise, typically have a higher amount of pain than those who run recreationally, right? But just like a squat, just like a run, just like a lunge, there is a right and a wrong technique to running, right? So, we're PTs, we're not running coaches. I think you've heard me before, I don't like running. So there are people who can help you and do running analysis and tell you, maybe there are a couple of modifications that you can make in your form or in your shoe wear that can help decrease your pain with running. But you can have arthritis and still enjoy running.
Great. We got a few questions about clicking in the knee. So someone wrote, my knee clicks when I bend it. What would cause this?
So this is a good question. A lot of people come in because they start freaking out. Like, every time I bend my knee, I hear it clicking, or like, what is this? Why is this happening? So normally my line is, some people are just more musical than others. Like, some people really just do have more clicking in their joints than others. If your clicking is not associated with pain, you're okay. I have clicking everywhere too. It's okay. I bend down to pick something up and everything clicks, but I don't have pain. It's okay. If you do have pain associated with the clicking, then you might want to just be assessed or look into that a little bit further. It also depends on where in the actual knee you do have the clicking. So just something to note there.
Great. Can osteoarthritis be stopped, not just slowed down?
No. Actually, that is one that can be definitively answered as a no. Arthritis, once you're diagnosed with it, it's a progressive condition, so it doesn't go away, and that goes for all joints in the body, right? Arthritis in the fingers, shoulders, hips, ankles. Once you have it, you have it. Because it's a wearing away, right? Again, if you have, think of like cartilage as like a Vaseline that lubricates this repetitive movement. And that eventually is just going to slowly just get worn away, and our body doesn't put cartilage back down, okay? What it actually does is, once it's bone on bone, which is arthritis, the body's actually going to start producing more bone, right? That's what it's going to think it's going to have to do. And that's what actually starts to cause inflammation of that bone, hence the arthritis. So the only thing that would stop it, right, is getting a knee replacement, and it's our job to try and prolong that as much as possible for you. But in short, no, we can't stop arthritis. It's a progressive condition.
Great. A lot of questions about arthritis. Is running bad for your knees, specifically marathon or ultra marathon running, but running in general?
No, I don't think so. What do you think?
No. You just have to do training. Like, you have to be smart about the way that you train. A lot of the times people who are runners or ultra marathoners or marathoners, they really focus on the running aspect of it. But what you have to do is the way that you train, you really need to make sure that you are training in different ways. So yes, running is obviously important when you're doing it, but maybe working in a different type of cardio or trying to swim, something that's non-impact, maybe biking. Also, strength training is super important. I have a lot of people who come into me, strength training.
Yes.
I have a lot of people that come into me that are marathon runners and never have done any leg exercises. They think that, oh, when I go for my run, that is my leg day. No, that is not your leg day. That is just the cardio aspect of it. You need your legs, your core to be super strong. So along with the running, when you're doing it, you need to make sure you're doing tons of leg exercises, tons of core exercises, just like the ones that we showed you today, and progressing that.
Yeah. One thing to add to that, let's go back to way in the beginning of this webinar when I was talking about those 3 planes of movement, right? When we think about running, we're just moving in this one direction, right? And don't forget about the rotation in the horizontal plane. So you have to do a lot of cross training as a runner. You got to work in these rotational and horizontal planes to strengthen these lateral muscles, because that's going to make you a better and more efficient runner. Your muscles won't have to work as hard, and you're going to put less stress on your joints. Okay, so cross training and strength training, other forms of training is going to help your running.
Okay, I have a 2-part question about squats. One is, does it matter if your feet are hip distance or wider? And the second part is, should your knees be tracking over your second and third toes?
Wow, those are very specific.
Those are.
And those are great. Second and third, yes.
So for the first part of your question, it's perfectly fine to have a wider stance, right? I'm 5'7", so it's a little bit awkward for me to have a little bit of a wide stance. I actually can't keep my knees tracking over my second or third toe. So, you know, that answers your second question. Yeah, when we talk about tracking over the toes, second or third toe is really what you're aiming for. If you're a little bit towards your big toe, that's okay. As long as if you're looking at yourself in the mirror and it doesn't look like this, right? So if I put this kind of bar right over my foot, right over the inside of my foot, it should kind of stay kind of hitting my inside of my foot, right? If I start to do this, see how now I put it down and now it's contacting the ground, it's non-contacting my foot. So if I have this bar here, my knee is over my second and third toe, okay? But the stance does not matter, okay? Wide stance is fine, okay? For you taller people, you might need that. A little bit more narrow is fine as well, okay? Again, as long as we're not getting that valgus and, you know, the knees aren't going way this way and your feet aren't coming off, then that's fine.
Great. I love the poll. That's a great way to look at it. Yeah.
Yeah, I'm using the
I'm a big poll
bowl.
guy.
No, it's very helpful.
Good visual.
Another question about squats. Someone said, I find doing squats extremely painful on my knees. Should I still try to do them? Will it make my knee stronger or will it injure it further?
If you are having pain during anything that we told you to do today, you should stop. Do not use pain as your guide. This is usually what I tell my patients with activity if they ask they can get back into running or anything like that. Use pain as your guide. Pain is basically your body telling you that something's going on that's not great, right, inside in the body. So if you're having pain and you're saying it's extremely painful, like definitely don't do anything that's causing you pain. You can come in and be assessed. You can do telehealth and be assessed through that way. It might be literally something super small that you just need to change with your body mechanics that we went over that could make squats pain-free. And I've had that happen a lot of times with patients. So just like try and keep note what we had said before if you want to review and go back and watch the video. But if you're still having pain with proper body mechanics, definitely just call and try and schedule an appointment, just because I don't want you to do anything that's causing you pain.
One quick assessment that you can do on yourself is, you know, if you have pain with a squat, I immediately have my patient do a half of a squat on one leg, right? And now you're looking for, is this hip dropping? Is this knee turning in? Then, okay, now it makes sense why you're having some pain with squats, because you know you're lacking the hip stability or possibly balance on that foot, and that's causing that. So you might just need an assessment. Again, squats shouldn't be painful. They should be a great exercise. But if you're having pain with them, it's time to seek some consultation and get that checked out.
Great. I think we only have time for about 2 more questions. I know there was a lot more. So if we don't get to your questions today, please grab our contact information at the end of this so you can send your questions to us. Can you share the 3 points of contact again for a squat with the stick on your back?
Everybody loves the poll, yes.
Visual.
Okay.
That's cool.
So 3 points of contact. Let's just make sure, I'm turning around, so let's make sure the screen.
Yeah.
So
Okay.
behind my head, okay. For those of you who have like forward head posture, it may be a little bit hard to get that. So don't worry too much about the head, but between the shoulder blades, okay, the upper back and right at the butt, okay, your sacrum bone here. So when you're doing the squat, you're ideally maintaining all 3 points of contact, okay, throughout the squat, and also with the deadlift if you're doing deadlifts as well. I would say the bottom one is the most important because that's the one where you're going to start to overuse the lower back, okay, when you're doing the squat. But it's behind the head, between the shoulder blades, and right at the base of the butt at the hips.
Great. And the last question we have time for today is an exercise bike good exercise for any kind of knee pain?
Exercise bike.
And is an exercise bike good exercise for knee pain?
I mean, biking in general is good. But again, if you have pain while you're biking, you might have to modify what you're doing, either the intensity, how you're doing it, how long you're doing it, and then scaling back up. But biking is a great exercise. There's nothing wrong with biking.
If anything, if you have a lot of pain with running, cycling, you're not contacting and impacting the ground. It's more of just an unloaded exercise or repetitive unloaded exercise. That's actually a great thing for your knees. So that should be perfectly fine. Again, as long as you're not having pain with it. And if you are, come see us.
Thanks, guys. We are actually going to put up some information for if we did not get to your question, please email Kristen, Dawn. We hope today's talk was valuable and that you learned a few ways to prevent and perhaps manage some of the symptoms you may be experiencing in your knees. If we didn't get to your questions, we'll do our best to reach out to you directly afterwards, and we'll be sending a handout of the exercises for you to have as a reference. As a reminder, your presenters today were Kristen Markoe and Dawn Zerio, our amazing PTs from our 57th Street location. Feel free to jot down their contact info so that you can reach out to them directly with any other questions you have or to schedule an appointment because they clearly know their stuff and you would be in great hands with them. Our Q&A moderator is...
Use the poll.
You can use the poll with Dawn. Our Q&A moderator is Chris Cottrell from our Brooklyn Heights office. And I am Ashley Rosick from our 57th Street location. Please feel free to reach out to us as well, and we can help with any questions you might have or help you get set up with an appointment. As an orthopedic outpatient physical therapy practice, we treat an array of conditions from head to toe, and we are open for in-person visits as well as telehealth sessions. Should you feel that you could benefit from some individualized guidance and treatment, please don't hesitate to reach out to any of us individually, and we will personally coordinate you being set up with one of our team members for an evaluation. Lastly, at Spear, we will be hosting our next webinar next Thursday at 5 p.m. on ergonomics for all of you working at home, which is basically almost everyone. So we look forward to seeing you there. Thank you all very much for spending time with us today. We hope you enjoyed the webinar, and we wish you all the best.